the big, really important thing that's out there today is in the Wall Street Journal, because this is something that affects you and your family. It is the health care reality check that is taking place in Massachusetts. And the health care plan they have is a role model. It is a miniature laboratory, if you will, for Obamacare. And even Democrats have described it that way. Insurance rates are going through the roof. The governor has imposed price controls. The insurance companies who ask for their rates to be raised are nonprofit companies. Nonprofit. Tomorrow, Massachusetts, or today, Massachusetts, tomorrow, the rest of the nation. This week, it became impossible in Massachusetts for small business and individuals to buy health care coverage after the governor, Deval Patrick, imposed price controls on premiums. Read on, because under Obamacare, this kind of political showdown will soon be coming to an insurance market near you. The Massachusetts small group market serves about 800,000 residents, shut down after the governor kicked off his reelection by presumptively rejecting about 90% of the premium increases the state's insurers had asked regulators to approve. They had to go get approval to raise their rates. They went. Deval Patrick said, hell no, you're not going to, and started tarring and feathering the companies as part of his re-election campaign. Same thing Obama has done, is demonize these people. These are non-profit companies. Health costs have run off the rails since Mitt Romney and Beacon Hill passed universal coverage in 2006. Deval Patrick now claims price controls are the sensible response to this industry greed. Exactly what we were discussing yesterday. There is no greed in industry. These are nonprofits. They're trying to make enough money here to stay in operation in Massachusetts. The real be found inside most Congresses and legislatures in the states these days. That's where the greed is, not in the free market. All of the major Massachusetts insurers, health insurers, are nonprofits. 3 of the largest 4, Blue Cross Blue Shield, Tufts Health Plan, and the Fallon Community Health, posted operating losses in 2009. In an emergency suit heard in Boston Superior Court yesterday, they argued that the arbitrary rate cap, the price controls, will result in another $100 million in collective losses this year, make it impossible to pay the anticipated cost of claims. And this gets even better. Stick with me. It may even threaten the near-term solvency of some of these companies. So until the matter is resolved, the insurers have simply stopped selling new policies. They're not selling anything. That's their response. Now, let's extrapolate. In Massachusetts, the government can't take over for the insurance companies, or doesn't want to. In the case of Obama, when this happens, as we predicted, as a lot of people predicted, when this happens in America's private sector nationwide, that's when Obama will move in, if this happens, and get his single payer. When the insurance companies can no longer stay in business, even if they're nonprofit. They're just going to quit. That's the objective, mark my words, of the Obamacare problem. A court decision on the insurance company lawsuit is expected by Monday, but state officials in Massachusetts have demanded that the insurers, under the threat of fines and other regulatory punishments, resume offering quotes, price quotes by today, and to revert to year-old base premiums. So the state of Massachusetts, you're not selling policies? Fine, you've got to better start quoting for people that want to buy, and you're going to quote last year's prices. And they talk about greed in the private sector.